Welcome to Discussions with Dr. G, where you get a little entertainment with your education. I'm Dr. G, and this episode is focused on antibiotics affecting protein synthesis. So let's kick things off with the Sunburn Squad, tetracyclines. I call them that because honestly, if you've ever seen a patient on doxycycline after a day at the beach, you know exactly what I mean. These antibiotics are like the Swiss Army knives of the drug world. Broad spectrum, great for atypical infections like chlamydia and mycoplasma pneumoniae, and of course, a go-to for acne and Lyme disease. I mean, if you're a traveler, doxycycline is practically your best friend, unless you're planning on sunbathing, in which case you should bathe in SPF 100 first. But here's where things get interesting. The side effects. They're memorable. Photosensitivity is the big one. Patients can go from 0 to lobster in a single afternoon. And then there's the classic tooth discoloration in kids. Yellow-brown permanent teeth, which, let's be honest, it's not the souvenir anyone wants from childhood. GI irritation is another favorite. If you don't take it with enough water, you're basically asking for esophagitis. Now, I always tell my students, tetracyclines in milk are mortal enemies. Let me explain more simply. Calcium binds up the drug so it can't be absorbed. So if you want your antibiotic to actually work, keep it far away from dairy, antacids, and iron. Don't even get me started on the oral contraceptive thing. Let's just say surprise babies are not a side effect you want. Bottom line, tetracyclines are fantastic, but you got to respect their quirks. No sun, no milk, and definitely no kids. That is, under 8, or pregnant patients. And always take them with a full glass of water on an empty stomach. Trust me, your esophagus will thank you. Macrolides. Moving on to the next club. These are your go-tos for respiratory infections, chlamydia, pertussis, and even H. pylori if you're dealing with ulcers. Azithromycin, the famous Z-Pack, is basically a household name at this point. But as much as I love their coverage, they come with their own set of drama. Mainly the whole QT prolongation thing. I mean, who doesn't love a medication that can make your heart do the electric slide? Not in a good way, by the way. Erythromycin is notorious for causing GI upset. If you want to clear out your patient's intestines, that's your drug. But the real kicker is the drug interactions. Macrolides are a major CYP450 inhibitor. So if your patient's on warfarin, for example, you better be watching those INR levels like a hawk. Let's just say you have the following case. A patient on azithromycin and warfarin comes into the ED with a nosebleed that just won't quit. I mean, it's pouring out. You run a set of labs and it turns out their warfarin levels shot up because of the interaction. Fun times for you, the patient, and now environmental services too. Now, when it comes to EKG monitoring, if your patient has any kind of cardiac history, don't mess around. Get that baseline EKG and keep an eye out for any signs of arrhythmia. I know it sounds tedious, but trust me, you do not want to be the nurse who misses a torsade de pointes. And just a quick tip, most macrolides should be taken on an empty stomach for best absorption, except azithromycin, which is a little bit more forgiving. But always warn about GI distress because it's probably coming. So, to sum it up, macrolides are powerful, but you got to respect the heart, meaning check the EKG, watch for drug interactions, and brace yourself and your patient for some GI fireworks. Now for our heavy hitters, aminoglycosides. These are nephrotoxic ninjas of the antibiotic world. Gentamicin, tobramycin, amikacin. These drugs are reserved for serious gram-negative infections, and sometimes you'll see them paired up with other antibiotics to get that synergistic effect. But oh boy, the risks. Nephrotoxicity and ototoxicity are the big ones. Your patient can develop irreversible hearing loss after a course of gentamicin. The thing with the aminoglycosides is you have to monitor everything. Peak levels, trough levels, renal functioning, hearing. I remember my first year teaching pharmacology. I was so paranoid about students forgetting to check the levels that I made them recite the process before every exam. When do you draw the trough? When do you draw the peak? I probably sounded like a broken record, but hey, nobody forgot it. And don't forget to hydrate your patients. Hydration helps reduce the risk of kidney damage. Plus, watch out for any signs of neuromuscular weakness, especially if they're on muscle relaxants. So if you take anything away from this, aminoglycosides are lifesavers, but only if you're religious about monitoring. Protect the ears, protect the kidneys, measure those levels like your nursing license depends on it, because honestly, it kind of does. All right, that's a wrap for today's episode. Remember, antibiotics affecting protein synthesis are like ribosomal wrecking balls. Super effective, but they can leave some collateral damage if you're not careful. Use them wisely, but keep an eye on those side effects, and your patient's kidneys and ears will thank you. Catch you next time for more pharmacology fun, because let's face it, microbes never take a day off.